Welcome to Health and Wellness. I'm Dr. Jennifer Ashton. The topic for today, Dentistry 101. We're going to give you all the tips you need to help keep your teeth in great health. So we decided to pay a visit today to my dentist, Dr. Patricia DeSalvo, here in her office in New Jersey. How many patients feel like I do when they just dread coming to the dentist? As soon as they sit down in this chair, they get white-knuckled, panicked, their jaw tenses up.
There are really a lot of people that come in like that. And really, initially, it's a very simple exam. We're just taking a look, we take some x-rays, we see what's wrong, and then we take it from there.
What can people do if they're really, really anxious?
Feeling comfortable with your dentist is one of the biggest things. And then when you're here, we can always use, I do use nitrous oxide sometimes, which is just a calming effect.
Is it safe to get gas sedation, nitrous gas sedation in a dental setting?
Doctor should know everything, that medications you're on, your history, your health situations.
What is the most common dental mistake you see patients making that if they corrected, they could really improve their dental health?
Flossing is one of the most important things and one of the most neglected things that are done. Home care can prevent so many dental situations.
Are you supposed to floss twice a day, 3 times a day?
Ideally, they say, I mean, if you floss 2 to 3 times, great, but once a day is what we would love our patients to do.
Is there a right way to floss?
Absolutely. What people do is they'll take the floss and they'll just snap it in and snap it out. We don't want to do that.
Okay.
You actually, here's my teeth, you actually want to make a C shape around the teeth and pull it on both sides. And floss up and down like a C, and then pull it the other way and floss up and down into the gum.
And just snapping it in and out would potentially bring more plaque and debris into the gum?
You want to just scrape that side with the floss, basically.
Okay, so I was doing it wrong. Now, periodontal disease affects how many millions of people, right? I mean, it's estimated about half the country, right?
Mm-hmm.
And it can start with children, really, right?
It can start very early. There are 2 basic forms, are gingivitis and periodontitis. The gingivitis part of it is just the gums, where you have maybe just a little inflammation, a little swelling, which is just the gum area here.
Okay. So that's if your gums bleed when you brush your teeth.
Right.
Is that common? Is it bad?
Well, common because a lot of people have the disease.
It's not great.
It's not good. No, it only means you should be brushing a little bit more, flossing, things like that.
Okay. And then when it goes from gingivitis to periodontitis, what's going on then?
Now you're starting to lose some of the bone that's supporting the teeth.
And there's been, it's not even so recent anymore, but pretty much in the last 5 to 10 years, a lot of evidence that links periodontal disease to heart disease. So actually telling patients to go to their dentist regularly and often not only can help protect the health of their gums and their jaw, but also their heart potentially.
Absolutely.
Right? Let's start with whitening. First of all, is it safe?
Absolutely safe. I mean, we always recommend that you use things that are accepted by the ADA, that they recommend over-the-counter type bleaching systems.
Do they work?
Some of them do. If they're used consistently, I have seen some very good results with them. The thing with over-the-counter bleaches, as opposed to what we would prescribe or give you from here, is it's a lesser percentage of bleach. So it's going to take longer.
Is there a minimum or maximum frequency that someone can safely whiten their teeth?
I've never seen damage done, but people who use it diligently and actually get it to a point where your teeth are going to stop getting whiter. Plus, people have to consider too, if you have dental work,
right, that
will not bleach. If you have crowns, if you have veneers.
People, I think, a lot of times will think of a good smile as just something that's aesthetic and cosmetic, but it really isn't. It's not only important to how you chew, but again, your overall health. You know, it's one of the first things that we as doctors look at is someone's dental health. And if they have poor dentition, that is really a screaming red flag for us that they're going to have other negative health consequences as well. So they really do go hand in hand, right?
Absolutely.
So thanks for joining us for another episode of Health and Wellness. I'm Dr. Jennifer Ashton. Remember, floss your teeth. And until next time, wishing you good health.